Our next witness is Joshua Lafazan. Josh, come on up. Josh, as many of you know, is probably the most famous Board of Education trustee on Long Island. And more importantly, he's a board member of LICAD and a leader of our youth for trying to end the addiction problem among our youth. And Joshua, thank you very much for what you've done and your testimony today.
Thank you very much for that introduction, Senator Boyle, and good morning, Senator Boyle and Assemblyman Saladino. Thank you for giving me this platform to share my knowledge and insights regarding one of the most pressing issues facing Long Island today, the heroin and prescription drug epidemic that is wreaking havoc on today's youth, regardless of education, race, ethnicity, or economics. To familiarize you with my background, I am 19, an elected official on the Syosset School Board of Education. I am on the Nassau County Youth Board of Directors, the Board of Directors of the Long Island Council on Alcoholism and Drug Dependence, a member of the Nassau County Heroin Prevention Task Force with Renee, and the Long Island Youth Safety Coalition, also with Renee, in addition to being a volunteer firefighter in the Syosset Volunteer Fire Department. My perspective on this issue, however, really comes from my experiences as the founder and CEO of Safe Ride Syosset. Safe Ride Syosset is a community outreach program aimed towards eradicating teenage drinking and driving in the Syosset community. I began this program to offer an option for those students who would choose to get in a car with a drunk driver rather than call their parents. I offer a no questions asked, no judgments passed option for those students who want to get home safely. As my program evolved, I also ended up driving home students who chose to call me rather than drive drunk in addition to driving their passengers. By choosing to abstain from alcohol and drug use in high school, I was in the minority within my school. My athletic, social, political, and educational involvement within school helped foster new relationships while retaining old ones, allowing me to be connected to a large percentage of the student body. These peer relationships have provided me with a deeper understanding of the current youth on Long Island. While operating Safe Ride Syosset, I learned that most of the teens are aware about the dangers of drinking and driving. It was only a small minority that were leaving themselves exposed to this problem. My experiences confirm the significant success, education, and awareness had regarding the issue of drinking and driving. Even some of the worst abusers of alcohol would abstain for one evening to be a volunteer sober driver for Safe Ride Syosset. However, it is only the separation of these two issues that has improved. Unfortunately, the number of overall youths who drink to excess continues to rise. It is an unfortunate reality that many of my former classmates are now addicted to prescription drugs and heroin. This group of young adults has a common denominator among them. All, not just some, began their journey towards addiction with the gateway drugs of alcohol and marijuana. Once kids have become addicts, the success rate of recovery is very low. The amount of resources and energy required to save these kids is disproportionate to the level of success. We continue to fight and try because no one wants to give up or admit this problem is unsolvable. The medical analogy is smoking and lung cancer. We can spend all our resources fighting the inevitable losing battle to lung cancer, or we can expand our resources preventing kids from smoking in the first place. We need to fight the cause of the illness, not the result. No one can predict with certainty which teens will elevate their use of drugs, going from recreational marijuana and alcohol use to harder drugs such as heroin and oxycodone. We need to fight more fiercely on the battlefield of prevention. It is where we have a chance to succeed before so many are lost. Stopping all teens from recreational use of alcohol and marijuana is an unrealistic expectation. What we can do is identify which teens and which environments will leave kids at a greater risk to succumb to drug abuse and the eventual spiraling down to heroin and prescription drug abuse. Parents need to play a more active role in identifying the potential risks to their children much earlier on, before recreational use goes too far. Too many parents today expect the schools to assume responsibility to educate, develop, and prepare their children for life. We have to challenge parents to once again take responsibility for their children in all aspects of life. Education in this area is where we can achieve the greatest success through prevention. No teen says they intend to become a drug addict, as they most likely think they are recreational users. However, their level of self-esteem and self-respect play a huge role in predicting who will eventually become an addict. The students who have difficulty fitting into a social group are very susceptible to joining a peer group of drug users. The parents need to become more aware of their children's habits, activities, and friends. Lack of parental supervision allows abuses with a lack of consequences. Parents need to be provided with more educational resources to help identify the beginnings of recreational use turning into abuse. Much in the same way as peer groups now take away the keys of their friends and stop them from driving drunk, we need to educate the youth to protect their friends by challenging them to get help when they see their peers abusing the gateway drugs of alcohol and marijuana. The kids in 9th grade that are drinking a couple of beers on the weekend evolve into the kids who are drinking hard liquor regularly in 10th grade and then experimenting with prescription drugs in 11th and are soon out of control. The sophomores who smoked marijuana casually with friends on a Saturday night became the seniors who smoked every morning before school started. Whatever their gateway drug of choice, they are all now fully engulfed in the wrath of addiction, and very few of them are receptive or will succeed to kick the habit even with treatment. The teen who is a casual drinker and smoker and does not realize that he or she is at risk can be identified and helped before it is too late. With early screenings and preventative care, millions of teens can be saved. Parents should be encouraged to give their children simple urine drug tests randomly and frequently. If it became an acceptable part of parenting, there would be less criticism of the practice. Since all drug abusers lie to hide their abuse, we need to educate parents to stop being naive about their children. They need to take their heads out of the sand and stop looking the other way. They need to stop the attitude of "that is not my child." America needs to wake up and realize it is everyone's child. We need to attack this problem with aggressive tactics. When you add up the cost of addiction on society, the resources that should be allocated to prevention should be formidable. Educate the children, educate the parents, educate the peers, and educate the teachers. Car insurance for teens should be tripled in price, with those passing drug and alcohol tests regularly receiving deep discounts. That would motivate parents to test their children. Health plans should also offer a discount for those teens that pass the same test. Unpopular, politically incorrect actions are part of the recipe for success for this problem. We need to be pragmatic and realistic and not choose the easy way out. The children of this country are at risk. When will we take massive action to change the course of our society? This will take courageous governmental leaders to find the resources for experts to develop a comprehensive plan to save the children of our society. We have to call on our finest child care professionals, school counselors, and drug professionals to address these issues and develop ways to help parents accurately diagnose their children's actions at a young age. The 4 years of high school are the battleground. We need to help parents determine if their own kids are susceptible to becoming addicts and help them identify those children heading down the dark path of addiction and give them the tools to fight this behavior while it is still controllable, or we will continue to lose the battle and continue to fight addiction after our teens have fallen prey to this disease. As we are focused here this morning on heroin and prescription drug abuse, we must also address the abuse of Adderall among high school and college students. Too many students link the positive objective of good grades with the abuse of Adderall and fail to recognize its dangers. They perceive they are not doing anything wrong because its use is for a good result. In conclusion, despite the help of dedicated school counselors and faculty, we are still seeing kids on Long Island becoming addicted to heroin and prescription drugs in record numbers. Despite the work of private organizations such as LICAD and Karen, we are still seeing a record number of overdoses. Despite the unprecedented advocacy from mothers and fathers who have lost loved ones, such as FIST, which is an acronym for Families in Support of Treatment, we are still seeing insurance companies deny those who are in need. So my message here this morning is that our fight is tougher than ever, and we have to continue to build our coalition so we can finally see the day where every kid who needs help gets help and every family who needs support gets support. Thank you again for this wonderful opportunity to speak out on an important issue.
Thank you so much for your testimony, Josh. It was very well done, and I appreciate your advocacy here and for the work that you've done. I think few people of your age can say they literally have saved lives. I'm sure that you have.
Thank you so much.
And we look forward to working with you as we go into the new session on legislation. Thank you. And we'd love to have you up to Albany with your passion and advocacy.
Thank you so much for your time this morning.
Thank you. Our next witness is Todd Benjamin, educational social worker with the Jericho School.